Hello again, I'm Dr. Lennox Hoyt, fellowship-trained urogynecologist and board-certified pelvic surgeon. We're talking today about urinary incontinence, which is a pretty distressing symptom that women can have. There are a number of approaches to managing or dealing with urinary incontinence, and really it depends on what a woman's desires or wishes are. One method of dealing with urinary incontinence if you're a woman who's having this problem is to try and cope with it. And if you're coping with it and wearing diapers and changing pads and managing that way, changing your lifestyle, altering the things that you do, refraining from certain activities and so forth, if that works for you, then that's certainly an option, because as a general matter, urinary incontinence is not life-threatening. If on the other hand, you're actually looking for a symptom-free normal situation, you want to really look at urinary incontinence a little bit differently. Because urinary incontinence has risk factors. One of the big risk factors is aging. Another one is childbirth, for example. There's some other risk factors, including low estrogen levels in the body, menopause, and so forth. One of the other things that may be associated with urinary incontinence, especially if it's triggered by aging or it's related to aging and being postmenopausal and so forth, is there are other things that affect your lifestyle. There's hot flashes. There is difficulty with intimacy. There's vaginal dryness. There's pain with intercourse. That sometimes would affect a woman's quality of life to the point where she just changes from who she was in her 30s to somebody different, somebody a little more restricted, a little more controlled, a little more banked, and careful about her surroundings, knowing where all the bathrooms are at the mall, for example, refraining from certain activities, not wanting to romp with the grandkids as much as before, and not wanting to engage in intimacy. So if urinary incontinence for you is a marker for some of these other associated symptoms, you want to be really considering that maybe you want to be in a lifestyle that you're in a symptom-free normal. Yes, it's normal to age. Yes, it's normal that in aging, your estrogen levels drop. Yes, it's normal that you lose muscle mass and so forth. But the fact that it's normal doesn't mean it has to be acceptable. And so the notion of a symptom-free normal, we can address vaginal dryness and urinary urgency, frequency, and incontinence related to menopause. Yes, we can impact pain with intercourse that's due to vaginal atrophy. Yes, we can affect pain with intercourse that's due to pelvic muscle spasms. So there's lots of opportunities for addressing the associated symptoms that come in a briefcase together with urinary incontinence. And if you're looking at the symptom-free normal, and urinary incontinence is kind of like the marker for things going wrong, where it sets the alarm, if you will. It's the last straw in the menopause cascade, if you will. And you want to have that addressed. Then it makes lots of sense to get a good, full evaluation, thorough evaluation by a fellowship-trained urogynecologist who can help you not only diagnose and figure out how to treat your urinary incontinence, but can address some of the other things, symptoms that travel together in the menopause cascade, of which there are quite a few.